Hi everyone, it's Dr. Palvia again from Physiologic in New York City. Today I want to talk to you about another common topic I like to discuss with my patients, and that is medical marijuana. Medical marijuana was legalized in New York in 2016, and since then it's really transformed my practice. Medical marijuana is approved for a variety of conditions, and for those you need to see an MD to be certified for them. Those conditions include chronic pain, PTSD, spinal cord injury, Huntington's disease, Parkinson's disease, HIV neuropathy, diabetic neuropathy, really any kind of polyneuropathy, epilepsy, irritable bowel disease, as well as multiple sclerosis, and also as an alternative to opioid abuse to help come off of opioid medication. So the way it works is you need to have a consultation with an MD, and through that we need to have a discussion and for us to determine that you have a certifiable condition, which is one of those that I stated before. You need an MD to certify you so that you can be then registered with the state of New York for the medical marijuana program. So let's talk a little bit about medical marijuana. Medical marijuana in New York is it only comes in liquid form, and the reason for that really is because smoking marijuana is considered hazardous to the lungs. It can still cause thermal injury to the lungs, and that's why that form is not legal in New York. So there's multiple forms that are legal in New York now. There's vape form, which has had some controversy, which I'd like to save for another video. Vape form is legal. Sublingual tincture, which is basically an oil under the tongue, and also a tablet form. There are no edibles or anything like that yet. There are some creams, but basically your tablet would be your edible format. So what are the difference amongst these? That's another question I always get. So all of these actually have the same strength. And I want to take a second and talk about strength. So there's basically two products in marijuana that have been, amongst many, but two that are really focused on when it comes to therapeutic benefit. THC, which a lot of people have heard of, as well as these days a lot of people have heard of CBD also. CBD and THC both are good for different types of pain. THC typically is better for muscle type pain, whereas CBD is better for inflammatory type pain. But the truth is they both work together. They both have a synergistic property, and that's why I believe it's important to have THC and CBD together rather than just some of your CBD only products, which for the most part have less therapeutic value because there's not enough THC in those typically. That being said, I do have some patients that benefit from CBD only, and the bottom line is if it's helpful, then do it. That's what I usually say. It's more or less harmless, and so if you find a CBD product to be beneficial, by all means you should use that. THC and CBD are available in the formats that I told you, and it's those products alone. So there's nothing else in there. It's not any of the other kinds of agents that you would find in marijuana. It is just THC and CBD, and they come in specific ratios. So basically in New York, you have typically the strongest versions are 20-to-1 THC to CBD. I think there are some places that have 40-to-1 now, but it started out the strongest would be 20-to-1. And that's still pretty common. And then the weakest ones are 1-to-20, which means 1 part THC to 20 parts CBD. Most patients, I usually start out at 20 CBD to 1 THC for a couple reasons. First of all, if you've never used marijuana, you may be concerned about the psychotropic effects related to marijuana. THC is what causes those psychotropic effects. That's what causes you to have that high feeling or stoned feeling. And CBD doesn't. So I usually like to start patients who are naive to marijuana on a high CBD, low THC, but that can definitely be titrated. I usually start people on a high CBD to low THC, and then we usually go up from there to titrate to efficacy, which basically means try to find a strength that's helpful for whatever condition that you have. And marijuana is not legal in recreational form, so I do advise patients not to use it for medical purposes only. And I also always give patients good advice about it. It is a state-run program, so if you are going to use it in the state of New York, you cannot travel outside of the state with it. That's against the law. You don't want to combine it with illicit marijuana. You don't want to combine it with alcohol. You don't want to operate heavy machinery or drive a vehicle under the influence of marijuana. Basically, you want to make good decisions. It is a medication. It can be very helpful, especially for certain chronic painful conditions or some of the other topics that I discussed earlier. All right, so how do you sign up for a card? Basically, you have to be evaluated by an MD, such as myself. We have our, again, I said we have our evaluation. We determine whatever symptomatology we're trying to treat, and then I have to certify you. In the certification process, once you do that, then you're eligible to get a license. So every medical marijuana user needs to have an official state license. It looks like a driver's license, and you get that from the state of New York. So there's an application process online that you have to fill out. Once you have that plus a certificate, then you're officially a medical marijuana card holder, and you can go to any dispensary in the state of New York to obtain medical marijuana. In Brooklyn, there's a couple dispensaries now. In Manhattan, that's where the first one opened. But now there's several. I think there's at least 3 or 4 in Manhattan. There's 2 or 3 in Brooklyn. In all 5 boroughs, basically, you have medical marijuana. So these days, the access is pretty easy. That's it for this one, guys. I hope you found it informative. If you have any questions, feel free to drop a comment below or shoot us a line. I'll see you in the next one. Thank you for watching.